Well, hi everyone. It's really nice for you to listen to an update from the front lines of BII research. So my name is Professor Anand Deva. I'm the head of plastic surgery at Macquarie University and also work at the Integrated Specialist Healthcare Foundation. And joining me today is the A number one double plus research assistant Robin Smith, who has contributed already so much to getting this trial up and running and ongoing. So I thought today the two of us will just give you a snapshot as to where we're up to, what our early findings are, and then reinforce the importance of generating good scientific data to support and give you answers, I think, ultimately, as to why many of you may be suffering systemic symptoms from breast implants. So look, I'll hand over to you, Robin. Thank you.
Thank you. As Arnett said, my name's Robin. I am the human face behind the Safer Implants email address, which you've all probably received emails from before. Can you see the screen okay, the sharing?
Yeah, absolutely. Yeah, great.
Great.
And
So
we should acknowledge our contributors on that slide, shouldn't we, Robin?
Yeah,
so,
please.
Yeah, so look, it's wonderful to have started this trial some time back, obviously run through Macquarie University, but you can see that we've got ASAPS as the Australian Society here, UNSW, Griffith University and Leeds Beckett University that are looking at some of the interesting data that's coming out, and the Global Alliance for Aesthetic Breast Surgery and the Integrated Specialist Healthcare Foundation. So many institutions, and of course our co-researchers named on that slide. Very grateful for this collaborative effort.
I'll just provide a few stats about where we're at now. So as you can see, we've got over 300 registered participants, 230 in the treatment group. So those are the people that are, experiencing those systemic symptoms and are having the explants. And then there's 52, 5 and 17 in the other control groups. And Anna, can you talk a little bit more about those?
Yeah, sure. So I think with any trial, you can look at, obviously patients with systemic symptoms, we want to work out what's going on, but you need to compare them to patients who are having revision breast implant surgery with no symptoms, and also some patients having a primary augmentation, so breast implants introduced for the first time. And we're also looking at a group of women with no implants but having other breast surgery, either breast reductions or breast lifts, just so we have some comparator groups to look at symptoms and recovery of symptoms from each of these interventions.
Great. And so we've got 288 active participants, and the average age today, which it does actually go up and down by a couple of years, but at the moment, the average age is 40. And what we can see based on the current data we've got is that the average number of symptoms that patients are experiencing before they explant is 12. So that's across the 158 people that have already responded to the pre-op survey. And then at 3 months post-explant, the average number of symptoms that people are experiencing is 3. So, and it just sort of shows there the top 5 symptoms that people are experiencing pre-op. I'm sure this will not surprise anyone who's gone through BII, but yeah, brain fog, anxiety, headaches, muscle pain, and chronic fatigue are kind of in the top 5. And then at 3 months, again, that anxiety is still lingering. The muscle pain, joint pain, visual issues, and numbness and tingling are the most prominent ones being experienced by people at 3 months.
We should point out, though, that's a significant reduction, right? So the number of symptoms goes down, and we're also measuring severity of these symptoms too. So we're showing a benefit there, aren't we, Robin?
Yeah, yep, absolutely. Yes to both. Yeah, huge. Sorry, it's about an 80% improvement going from 12 to 3, which is pretty exciting for people.
Yeah, it's remarkable, isn't it?
And so here's some interesting data. This is what we're seeing. There's a whole bunch of symptoms that people have reported, basically having a total resolution in their symptoms at 3 months. So shortness of breath, night sweats, discoloration of hands and feet, urinary tract infections, taste alterations, joint swelling, migraines, and swollen lymph glands. They're some of the things that have resolved for basically 100% of patients that have responded to the survey at 3 months. And then the symptoms below, they're the ones that have a very high resolution rate. So it's not 100%, but they're still resolving at a pretty high rate. So chronic fatigue, easy bruising, hair loss, that dry and fragile hair, food intolerances and allergies, and brain fog, which is really great.
Yeah, the numbers are really interesting, aren't they, Robin? So to me, that really parallels my experience, at least in clinical practice, where a lot of these things start to resolve at 3 months. The big question, of course, and this is why we're doing the study, is whether these symptom resolutions persist going further forward.
Yep, and I'm sure, that's what we'll be able to report on and see as the study continues. So this list here is basically a list of the symptoms that don't resolve as quickly, or they're not as frequent at actually resolving. So the panic attacks, numbness and tingling, vertigo, reflux, and joint pain and irritable bowel. So they still resolve 50% of the time, but these are basically the lowest resolution.
Yeah, it's interesting, isn't it, that you bring up anxiety features prominently in the top 5, and it still persists certainly in some women at the 3-month mark. It's one of those things that is debated a lot, and we've discussed this, whether anxiety is a cause or an effect. Do you know what I mean? And I think certainly we're seeing very high rates of anxiety in patients presenting to us with systemic symptoms. But we don't know whether this is something that they started with and has become worse, or something that's as a result of having implants, and that question still remains.
And I think also with those mental health aspects, we need to remember that there's a certain number in the population. There's a baseline
background. Yeah, exactly. But I think from looking at the data, Robin, that the levels are way above baseline, but interestingly, at 3 to 6 months, they're kind of dropping back down to where baseline is, right? Based on surveys. So yeah, terrific.
So moving forward, Anna, do you want to take over from here and just talk about what we're going to continue?
Yeah, so look, the findings are no surprise, I think, for those of us who are treating women presenting with systemic symptoms. It I guess, in my mind at least, validates the importance and the value of implant removal capsulectomy. I guess there's a few things that arise. One is what might be driving the systemic symptoms, and we've still a lot of work to do there. We're in the process, once again, thanks to Robin, of looking at a whole heap of biological data. So patients that have participated in the trial, and those hopefully that will, we do take a lot of baseline bloods looking for inflammatory disease, autoimmune disease, iron deficiency, thyroid deficiency, amongst other things. So we're looking at the results of those in the participants, and we also then are looking at results of capsulectomy. So we subject all the specimens we remove and the implants to bacterial testing, to histology, looking for underlying inflammation or any other changes. So that's a huge amount of work, as you can imagine, for the 180 or so women that we've got results on. So what will be interesting to then lay on is any positive biological data versus their symptom recovery. So if we can correlate, for example, high rates of inflammation or perhaps blood problems to women with higher symptoms, or perhaps with their response. Now, so bear with us. We're hoping to get to the bottom of that at least towards the end of this year, early next year. Once again, thanks to all the people that are helping. And so that's number one. We really, really, really need anyone who's lodged and part of the study to respond to the many emails that Robin is going to send you, or has already sent you, because now you can see how critical it is to send us your information. We really want to know what's happened to you since explant capsulectomy, whether or not you are one of the 80% or so women that have had good resolution of symptoms, and we also want to know if you have not as well. So because that will help inform us as to the value of what we're doing. We are looking at a subset of women that, and so those of you who have registered or will register for the trial, there is an opportunity to really go deeply into some of the effects on your mental health. So thanks to our partners at Leeds Beckett University, we're looking at this subset of women and really trying to use some, pretty amazing techniques, aren't they, Robin, to sort of tease out some of the psychological and the trauma-related impacts as a result of this. So if that is something that you want to participate in, please reach out. And clearly, if you are someone who doesn't know about the study or wants to know more, please, contact us. If you are presenting for assessment of systemic symptoms and are considering implant removal and capsulectomy, all you need to do is put your hand up, speak to your treating doctor, and we value input from anyone in Australia to be part of this going forward. So the two big messages are, if you're part of it, please send through your data and respond to Robin's emails. And number two, if you are someone who wants to participate in the study, please reach out and we'll be more than happy to welcome you.
Yeah. Great. And I think just echoing what Arne had said, if lots of people, their symptoms are getting better, and I know it's easy to go, yeah, I've got them out, and not report back, but we want to hear from you, even if you've got nothing to report. Here, so just take the time to fill out the survey and send it back, and it's really valuable information for the study.
Yeah, absolutely. I think we're all after answers, aren't we? At the end of the day, I mean, through some of what women have gone through, and hopefully, through maybe improvement after surgery. Every patient has a contribution to make. The information feeds into ultimately generating evidence and data that then strengthens our understanding of what might be going on. So it's one way that you can help us, and then ultimately the data and the answers can help you. So it's a good way to go.
Yeah.
As far as I'm concerned. Having done research for over 3 decades now, it's a lot of work, but it'll definitely be worthwhile. So thank you in advance.
Yes, thank you very much, and thanks for listening to our little update today.
Great.